Choosing a Medicare plan is one of the most important financial decisions you will make in retirement, and most people do it completely wrong. They pick the plan with the lowest premium and hope for the best. Today, I am going to teach you the exact step-by-step process I use to help my own clients find the best Medicare plan, including the insider secrets that most agents will never tell you. By the end of this video, you will know exactly how to shop for a Medicare plan like a pro, including the insider secrets that most agents will never tell you. By the end of this video, you will know how to shop like a pro. My name is Antonio Espino, founder of Espino Insurance Group. I am a licensed agent serving families across the entire state of Texas, including Brownsville, Harlingen, McAllen, and the entire Rio Grande Valley. I specialize in health, life insurance, and annuities. Whether you are turning 65, retiring soon, or already on Medicare, and wondering if you have the right plan, this video is for you. Step 0, before you do anything else, before you go to any website or call any insurance company, you need to understand the difference between your two main Medicare options. Option 1 is Medicare Advantage, a private plan that combines your hospital, medical, and usually drug coverage in one plan. It uses a network of doctors and often has lower monthly premiums, but has co-pays and a maximum out-of-pocket limit. Option 2 is Medicare Supplement, also called Medigap, which works alongside Original Medicare and helps pay your out-of-pocket costs. With a Medigap plan, you can see any doctor in the country who accepts Medicare with no network restrictions. The shopping process is completely different for each type, so knowing which direction you want to go first is the foundation of everything else. Option 1 is Medicare Advantage, a private plan that combines your hospital, medical, and usually drug coverage in one plan. It uses a network of doctors and often has lower monthly premiums, but has co-pays and a maximum out-of-pocket limit. Option 2 is Medicare Supplement, also called Medigap, which works alongside Original Medicare and helps pay your out-of-pocket costs. With the Medigap plan, you can see any doctor in the country who accepts Medicare. Knowing which direction to go first is the foundation. Step 1. Before you look at a single plan, make a list of every doctor you currently see. I mean every single one. Your primary care doctor, your cardiologist, your orthopedic doctor, your eye doctor. Write down their names and practice location. If you are looking at Medicare Advantage and your doctors are not in that plan's network, it does not matter how low the premium is. You will either pay out of network rates, which can be very expensive, or you will have to find a new doctor. Neither of those is a good situation. Step 2, make a complete list of every medication you are currently taking. Write down the name, the dosage, and how often. This is critical because every plan has a drug formulary, a list of covered medications organized into tiers. Drug costs can vary dramatically. A medication that costs $5 on one plan could cost you $50 or more on another. This is especially important if you take any specialty medications or brand name drugs that do not have a generic alternative. Step 3, go to Medicare.gov and use the Plan Finder tool. This is the official site to compare plans in your zip code. First, enter your zip code. This will show you every Medicare Advantage and Part D drug plan available in your area. Second, enter your medications. The Plan Finder will calculate your estimated annual drug costs, which is incredibly useful. Third, use the provider directory feature to search for your doctors and see which plans include them in their network. Fourth, compare the total annual costs, not just the monthly premium, including deductibles, co-pays, and your estimated drug costs. Now here's something I want you to know, something most people find out the hard way after they have already enrolled in a plan. Medicare.gov is a great starting point, but it is not always accurate. And I have research to back this up. Studies show that 58% of people who use Medicare provider directories have encountered incorrect information. And 80% of those people say the errors made them trust their health plan less. The new provider directory on Medicare.gov for 2026 has been reported to frequently produce erroneous and conflicting information about which doctors are actually in network. In fact, Medicare.gov is outsourcing its provider data to a third-party vendor, and there is no guarantee that the information is fully accurate or up to date. So please never make your final plan decision based on Medicare.gov alone. Step 5, and this is one of the most important steps in this entire video. Always call your doctor's office directly to verify they are in network. Do not rely solely on the Medicare.gov Plan Finder or even the insurance company's own website. Call the actual doctor's office. Ask them specifically, are you currently accepting patients under this specific plan name and contract for 2026? Write down the date of your call, the name of the person you spoke with, and what they confirmed. This documentation protects you if there is ever a dispute about your coverage. Here is a real example of why this matters. A doctor can appear in a plan's directory but no longer be accepting new patients under that plan, or their contract with the plan may have ended but the directory has not been updated yet. These are called ghost networks and they are more common than people realize. Ask them specifically, are you currently accepting patients under this specific plan, name and contract for 2026? Write down the date of your call, the name of the person you spoke with, and what they confirmed. This documentation protects you. A doctor can appear in a directory but no longer be accepting new patients. These are called ghost networks. Step 6. If you are taking any expensive medications, especially specialty drugs or brand name medications, do not rely only on the Medicare.gov drug cost estimator. Go directly to the insurance carrier's own website and find their official drug formulary for 2026. Find their official drug formulary for 2026. Formularies change every single year on January 1st. A drug could move to a higher tier or be removed entirely. Without verifying, you could end up with a very expensive surprise in January. Step 7. This is a mistake I see constantly. People choose a plan based only on the monthly premium. A plan with a $0 premium is not automatically a better deal than a plan with a $30 premium. Add up your estimated monthly premiums for the year. Add your estimated drug costs based on your medication list. Add your estimated copays based on how often you typically see your doctor and specialist. Add your deductible. Then compare the total for each plan you are considering. Sometimes a plan with a slightly higher premium actually costs you less in total when you factor in lower copays and better drug coverage. The only number that truly matters is your estimated total annual out-of-pocket costs, not the premium alone. Step 8. Pay close attention to the maximum out-of-pocket limit on any Medicare Advantage plan you are considering. This is the most you will ever pay out of pocket in a single year for covered medical services. In 2026, Medicare Advantage plans can have maximum out-of-pocket limits ranging from as low as $2,000 to as high as $9,000 or more. Always know your worst case scenario before you enroll. If you have a serious health event, a surgery, a hospital stay, or a cancer diagnosis, your maximum out-of-pocket limit is what protects you from financial catastrophe. Step 9. Check the prior authorization requirements of any plan you are considering. Prior authorization means the plan must approve certain procedures, tests, or specialist visits before you can receive them. Every Medicare Advantage plan has different prior authorization rules and they change every year. If you have a chronic condition that requires regular specialist visits, specific procedures, or ongoing treatments you need to make sure the plan you choose does not require extensive prior authorization that could delay your care. You can find this information in the plan's evidence of coverage document, which every plan is required to provide. If prior authorization is a concern for you, a Medicare Supplement plan may be a better option since Medigap plans generally do not have prior authorization requirement. If prior authorization is a concern for you, a Medicare Supplement plan may be a better option since Medigap plans generally do not have prior authorization requirement. Let me pull all 8 steps together into your complete Medicare plan shopping checklist. Step 0. Decide between Medicare Advantage and Medicare Supplement first. Step 1. Make your complete doctor list. Step 2. Make your complete medication list. Step 3. Use Medicare.gov Plan Finder as your starting point. Step 4. Remember that Medicare.gov is not always accurate. Use it as a guide only. Step 5. Always call your doctor directly to verify network participation. Step 6. Check the insurance carrier's drug formulary directly for expensive medications. Step 7. Compare total annual costs. Step 8. Check the maximum out-of-pocket limit. Step 9. Check prior authorization requirements for your specific health needs. Everything I just taught you is 100% doable on your own, but I also want you to know that a licensed Medicare advisor does all of this for you at absolutely no cost. When you work with me at Espino Insurance Group, I pull up your specific doctors, I run your specific medications through every available plan in your area. I verify network accuracy. I compare your total annual costs across every option. And I present you with a clear recommendation based on your personal situation. The entire process takes about 30 to 45 minutes, and it costs you nothing because Medicare agents are compensated by the insurance companies, not by you. So, whether you want to do this yourself using the steps I just taught you, or you would rather have me do it for you, you now have everything you need to make the best Medicare decision possible. It takes about 30 to 45 minutes and it costs you nothing. Medicare agents are compensated by the insurance companies, not by you. Before I wrap up, let me share 3 red flags to watch out for when choosing a Medicare plan. Red flag number 1, a plan that seems too good to be true. If a plan has a $0 premium, $0 copays, and incredible extra benefits all at once, look very carefully at the network restrictions, the prior authorization requirements, and the maximum out of pocket. Red flag number 2, a plan that does not include your most important doctors or medications. Never compromise on your health to save a few dollars a month. Red flag number 3, an agent who recommends a plan without asking about your doctors, your medications, or your budget first. A good Medicare advisor always starts with your situation, not with a plan. Whether you are here in the Rio Grande Valley, in Brownsville, Harlingen, or McAllen, or anywhere across Texas, in Houston, Dallas, San Antonio, Austin, or El Paso, I am here to help you navigate this process. I reside in the Rio Grande Valley, but I serve families throughout the entire state of Texas. I serve families throughout the entire state in Houston, Dallas, San Antonio, Austin, or El Paso. We can even meet virtually. If you prefer to meet virtually or over the phone, I can walk you through every single step of this process without you ever having to leave your home. At Espino Insurance Group, my only goal is to make sure you have the right plan for your situation, not just any plan. If you want me to do all of this for you completely free of charge, call or text me directly at 956-455-1313 or click the link below to schedule your free Medicare plan review. I will check your doctors, run your meds, and compare your costs at no cost. I am Antonio Espino with Espino Insurance Group, and I am here to make sure you get this right. Give us a call today.